Many programs that rely on federal funding may see that flow of money reduce or dry up altogether.
Any loss of federal dollars is a major concern at the Howard Brown Health Center in its fight against HIV. We get more now from WGN's Sean Lewis.
In the heart of Chicago's Lakeview neighborhood, the work to shore up health care carries on at Howard Brown Health.
We are a primary care provider.
Dr. Travis Gales
that has historically served the LGBTQ+ community
is the new CEO.
Historically, we've provided significant amounts of services to individuals living with HIV.
It is that conversation comprising so much of his time right now.
We have to be good stewards of taxpayer dollars.
As proposed cuts to the CDC to the tune of $793 million will cut directly into HIV prevention and treatment in education, medication, and other areas that have reduced new HIV cases in the U.S. by about 20% in the last 15 years. Illinois' Getting to Zero initiative looks to bring new cases down even more. Each case prevented, they say, saves $250,000.
An ounce of prevention is worth a pound of cure. Understanding that if we're going to end the HIV epidemic, that our best guess is through prevention.
AIDS Foundation Chicago is in direct line of fire of those cuts. More than 80% of its budget relies on federal funding for several of its initiatives. Nearly 40% comes from the CDC itself.
Some of the estimates show that with the cuts that have been made to the CDC and other entities, you're looking at potentially over 200,000 new cases over the next several years. We don't have to be in that space. We don't have to, because we have a playbook and a toolkit that we know that works.
We will defeat AIDS in America and beyond.
It was just 6 years ago that the first Trump administration made a commitment to HIV prevention funding.
To eliminate the HIV epidemic in the United States within 10 years, we have made incredible strides, incredible.
It has been widely, overly successful in making sure we bring down new transmissions of HIV. In the president's budget, they zero it out. That doesn't make sense. These cuts are going to impact people living with and vulnerable to HIV in all 102 counties of Illinois.
For now, it is a waiting game to see if the proposal in Washington becomes reality in Illinois and beyond.
And the fact that we have all of these tools available, that again, data shows have been effective and work, and we're being hamstrung in our ability as a medical community and a clinical provider community from being able to offer that to our patients, it's disappointing and it's insulting.
Sean Lewis, WGN News.